Hello, I'm Hannah Moore, a nurse practitioner student at Auburn University. Today we are doing a complete head-to-toe physical assessment. Upon entrance to the room, I have washed my hands and we are maintaining patient confidentiality and privacy. We took vital signs on our patient Thomas and they were all within normal limits, including weight and BMI. So first we start with our general survey. He appears healthy, he's in good spirits. There's no signs of distress, his speech is coherent and clear. His mental status, he is alert and he is answering questions appropriately. And then his skin color is pink and dry and there's no signs of flushing. His height and build, he is tall and he is healthy appearing. He is non-obese. He is a young adult male with no abnormal development. He has an upright posture with slight slouching. He ambulates steadily, moves all of his extremities. He is well-groomed in appearance, dressed appropriate for the climate, and there is no signs of body or mouth odors. So then we move on to the skin and nail assessment. The skin assessment will be done throughout this whole exam, but upon the first assessment, there's no obvious signs of rashes, bruises, or lesions. His skin is warm and it's dry. And then his fingernails, there's no clubbing, no cyanosis. And then the skin turgor, there is no tinting. And then we move on to the head. His hair is thick and it's coarse. There's no signs of lice, no signs of thinning. His scalp, there's no lesions, flaking, or lumps. And then the skull is normocephalic with no depressions. His face, cranial nerve 7. We're going to smile for me, frown, puff your cheeks, raise your eyebrows, close your eyes, resist me opening your eyes. Perfect. So cranial nerve 7 is intact. And then we move to the sinuses. First, we will palpate. Any pain?
Nope.
All right. And then there's no pain upon palpation and percussion. And then they are non-tender. And then we will also transilluminate the sinuses. All right, and then there's no abnormalities noted with the sinuses. And then we move on to the TMJ. Can you open your mouth and close? Was there any pain?
No.
So there's no pain upon palpation and no swelling noted. And so now we'll move on to cranial nerve 5. Can you clench your jaw for me? Perfect. Now I'm going to touch your face. Does the sensation feel the same on both sides?
Yes.
Perfect. So cranial nerve 5 is intact, and then we will assess the lymph nodes. So first we will start with the pre-auricular, post-auricular, occipital, submental, submandibular, cervical, and then supraclavicular. Any pain?
Nope.
Okay, so there's no swelling, they're non-tender, and they're mobile. Next, we move on to the eyes. First, I will inspect and I will just look at the outside appearance. The eyelids, there's no drooping. The sclera is white. The cornea is intact, and there's no redness or swelling of the conjunctiva. And then I will feel the lacrimal glands bilaterally. Any pain?
Nope.
No redness or tenderness on the lacrimal glands. And then we also did a visual acuity test using the Snellen chart whenever the patient entered our clinic, and his vision is 20/20. And then I will test the pupils. So pupils are equal, round, reactive to light. And then look at my finger, and they are accommodating. They're about 3 millimeters in size. And then his light reflection was nasal to pupil. And then we will do the points of gaze, which test for cranial nerves 3, 4, and 6. So Thomas, if you'll look at my finger and follow it. Perfect. So there's conjugate movement with no nystagmus or lid lag. And then Thomas, if you'll cover one of your eyes for me. All right, uncover. And do it with the opposite side and uncover. Perfect. So with the cover test, there's no lateral movement of the covered eye. And then next we'll do the finger wiggle. Follow my finger. Perfect. So visual fields are intact. There's no deficits. Next, I will inspect his eyes with my ophthalmoscope. All right, so if you look straight ahead for me. And then for the sake of this video, I'm just doing one side, but in reality, I will be doing both sides. So the lens and the retina, there's no opacities. The optic disc is round, it's yellowish orange and defined. The retinal background, there's no hemorrhages or exudates, and the macula and the fovea centralis is also noted. And then we will move to the ears. First, we will start with inspection of the outer ear. Do you feel any pain?
No.
Okay, so there's no pain upon palpation. There's no deformities noted or lesions. And then once again, we will be doing this bilaterally. So Thomas, I'm going to whisper something to you, and I want you to repeat what I'm saying, okay? 3D2C.
3D2C.
Perfect, and so he responded appropriately. Next, I will inspect the inner ear with my otoscope. And there is honey-colored cerumen. There's no redness or swelling. The tympanic membrane is pearly gray. It's shiny, and the cone of light is seen at 5 o'clock. All right, so now, Thomas, we're going to do a few things to test your hearing. We're going to do the Rhine and the Weber test. So first, we're going to start with the Weber test. I'm going to put this on the top of your head, and you tell me if the sound is heard equally or more in one ear than the other, okay?
Equal.
All right. Then we're going to do the Rhine test. So what I'm going to do, I'm going to place this behind your ear. You tell me when the sound stops, and I'm going to move it to the front ear. You tell me when the sound stops, okay?
Stops. Stops.
Perfect. So air conduction is greater than bone conduction. All right, and then next we'll move to the nose. First, I'm going to inspect the external nose. Is there any pain when I touch?
Nope.
Perfect. So the nose is non-tender. There's no deformity or lesions noted. And so now what I want you to do, I want you to cover one nostril for me. Breathe in. Perfect. Now cover the other nostril. Breathe in. Any difficulty breathing?
Nope.
Okay. So both of the ears are patent. There's no occlusions. And so next, I will take my otoscope and I will look internally. Look up for me. And both sides. Perfect. So the septum is midline. The mucosa is red. There's no drainage noted. There's no nasal polyps, no swelling. And then lastly, we're going to check cranial nerve 1, which is our olfactory nerve. Can you close your eyes for me? I'm going to hold a familiar object under your nose, and you tell me what it is.
Alcohol pad.
All right, perfect. Then we move to the throat, so we will begin by assessing the lips. They are dry. There's no cracking, no edema. And then open your mouth for me. Stick your tongue out. Say ah. Move your tongue back, side to side. Perfect. So the mucosa is pink and moist. There's no ulcers noted. He has no missing teeth. There's no obvious dental caries, and there's no gingival inflammation. The palate is intact. There's no cleft, and it rises on ah. This is part of cranial nerve 9. His tongue is pink and moist. There's no lesions noted, and then his stenosis and sublingual ducts were visualized. There was no deviation upon tongue movement, which is cranial nerve 12. And then we will also check cranial nerve 10. Can you swallow for me? Perfect. Cranial nerve 10, you also are supposed to check their gag stimulation, but for the sake of this video, we won't be doing that today. So cranial nerve 10 is intact as well. And then whenever I assessed the pharynx, there was no exudate, no redness, and no swelling. The tonsils were present, non-swollen, and no signs of an abscess. Next, we move on down to the neck. So upon inspection, I don't see any scars, any swelling or lesions, and then I will go ahead and check the carotids. All right, and they are equal symmetrically. And then what I want you to do, I want you to just move your neck all around. Perfect. Any pain?
Nope.
Perfect. So he has full range of motion in his neck. Now can you shrug your shoulders? Perfect. Push your hand against my face. And again on this side. Awesome. So that test for cranial nerve 11, which is intact. So now I will stand behind Thomas and palpate the thyroid. And can you swallow? Perfect. So no signs of a goiter. The thyroid rises upon swallowing. And then I will look, and the trachea is midline. Any pain?
Nope.
No deviation, no pain. Next, we move on down to the thorax and the respiratory system. So we'll go ahead and actually just take this off so we can do our assessment. So upon inspection, his respiratory rate is regular. The depth of respirations are regular. There's no distress noted. He's not using accessory muscles to breathe, and there are no supraclavicular retractions upon inspiration. So for our assessment, we will start with posterior first. So I will inspect There's no signs of any deformities. Lung expansion, can you take a deep breath? Perfect. So lung expansion is symmetric throughout. And then I'm going to palpate. You let me know if there's any pain or tenderness.
Nope.
No pain or tenderness. All right, so no pain upon palpation, no abnormalities, no crepitus. And then I'm also going to assess your spine. Any pain?
Nope.
So there's no malalignment on the spine and no tenderness. And then also there's no abnormalities to the ribs. So I'm going to put some pressure on your back. Any pain?
Nope.
There's also no CVA tenderness bilaterally. So what I want you to do, I'm going to put my hands on your back, and I want you to say 99, okay?
99.
And again.
99.
And again.
99.
Perfect. So there is no fremitus on either side. For his AP lateral ratio, it's 2 to 1. And then now I'm going to percuss in a ladder pattern. And there is resonance throughout, and it's equal on both sides. Last, I'm going to auscultate. Just breathe normal for me. Perfect. So I auscultated in a ladder pattern as well. There's no adventitious breath sounds, and they are clear and equal bilaterally. Okay, then we're going to move to the anterior part of our respiratory assessment. There's no deformities, there's no asymmetry. The costal angle is 90 degrees. So now we're going to palpate. Any pain?
Nope.
Nope, no pain. So there's no pain, deformities, or no crepitus upon palpation. And so now we're going to percuss. All right, and there is resonance throughout. We did the ladder pattern as well. So now I'm going to auscultate the anterior. Deep breath. And we go. Perfect. So there's equal vesicular breath sounds in all fields, and there's no adventitious sounds. So then we will move on to our breast exam. For females, this would be a little different, but for a male, we're going to inspect. There's no signs of dimpling, no obvious lumps or deformities. We can still palpate, see if there's anything abnormal, which there's not for him, and so we'll get you to raise your arm, and I'm still going to assess the axillary and lymph nodes, and there's no swelling, and there's no, did it hurt?
Nope.
Okay, and there's no tenderness to the axillary lymph nodes. Now we're going to move to our cardiovascular assessment. So I'll get you to lay back for me, Thomas. So upon inspection, there's no signs of JVD. And then I'm going to palpate the chest. Any pain? No. And then I'm going to assess for the PMI, which is located at the fifth intercostal space, mid-clavicular line, and it appears to be normal rate. All right, and then we will auscultate. I am using both the belt and the diaphragm, but I'm just going to do one for the sake of time. So first we will start at the aortic, then the pulmonic, Erb's point, tricuspid, and mitral. So sounds S1 and S2 are heard, there's no murmurs, and there's a regular rate and rhythm. And then I will listen to the carotids. And then the carotids, there's no abnormal sounds, no bruits, and they're equal bilaterally. And lastly, I will listen to the temporal arteries. There's no abnormal sounds there, no bruits, and they're equal bilaterally. Next, we'll move to the abdomen. So first, we will inspect. So there's no obvious rashes, scars, or any signs of an abnormality. The umbilicus is midline. There's no signs of a hernia. There's no redness, and the contour is flat. And then for our abdominal assessment, we will auscultate in all four quadrants. So bowel sounds are heard in all four quadrants. The renal, iliac, and femoral arteries are heard with no bruits. And then we will percuss. Tympany is heard throughout, and there's dullness over the liver. The liver span is between 6 to 12 centimeters. And there was also dullness over the midclavicular line for the spleen. So now, Thomas, what I'm going to do, I'm going to palpate your stomach first soft and then hard. Okay, you let me know if there's any pain. No pain? All right, so now we're going to do a little harder. Any pain?
Nope.
Perfect. So the abdomen is soft, non-tender in all 4 quadrants with light and deep palpation. There's no tenderness, no masses. The liver, spleen, left and right kidney are non-palpable. And then we will also measure the aorta. Lastly, for the abdominal assessment, we will check the abdominal reflex, and it is present. All right, next we will move to our extremities. I would assess the inguinal nodes, and I would also check the femoral pulse. For the sake of this video, we won't do that, but we'll just say that the femoral pulse is 2+, and it's expected. And then now we will inspect all of the extremities, and then upon appearance, there's no edema. The skin is warm and dry, and once again, I will just be doing one side, but in reality, I will be doing both. So I will check all of the distal pulses, so we'll do the radial, the popliteal, the posterior tibial, and the dorsalis pedis. All are 2+. And then, if you will sit up for me, Thomas, we'll move on to the neck. We went ahead and tested the strength of his neck earlier during our HEENT assessment. So now what we'll do, can you put your chin to your chest for me? And then ear to shoulders, head back. Perfect. Any pain?
Nope.
So he has full range of motion in his neck, and we already established that his strength is 5 out of 5. So now what I want you to do, I want you to put your arms up, behind your back, and then on top of your head. Perfect. So now pull against my hands. Now push. Perfect. So his strength is 5 out of 5. There's no decreased range in motion. So now we'll move on to your elbows. Can you extend your elbows, bend them, rotate them? Perfect. Bend them back up like this. Push against me. And perfect. So full range of motion in the elbows, and the strength is 5 out of 5. So now spread your fingers out, make a fist, twist your wrist. Perfect. So he has full range of motion in his wrist and his fingers. And then can you squeeze my hands? Perfect. And the grip strength is 5 out of 5. So Thomas, if you'll stand for me, what I want you to do, I want you to bend over and touch your toes. Perfect. And now I'm going to be feeling along his spine. There's no obvious signs of scoliosis, and you can stand back up. And then can you twist side to side? Perfect. And then bend back a little. Awesome. No pain?
Nope.
Awesome. So spine, he has full range of motion, no signs of scoliosis. And then I'll get you to go ahead and sit back down. And I'm going to extend this out for you. We're going to assess your feet and your ankles, and then you can just lay back. Awesome. So what we're going to do is I want you to point your toes towards you, and then away, and then rotate your feet. Awesome. Push against my hands. Perfect. So he has full range of motion in his ankles, and the strength is 5 out of 5. So now we're going to move to your knees. Can you bend your knees for me? Perfect. No pain. Awesome. So I'm going to put pressure on your knee. You push against me, okay? Awesome. So he has range of motion in his knees, and the strength is 5 out of 5. So now what I want you to do is just lay back and put your knees to your chest. Perfect. And can you raise your legs for me? Awesome. I'm going to push against you again. Perfect. So he has range of motion in his hips and his pelvis, and his strength is 5 out of 5. And then we move to our deep tendon reflexes. All right. And so first we start with the biceps. And just relax your arm. All right. And like I said, we'll do this throughout just one side, but typically we'll do it on both. And then we'll do the triceps, and then relax the brachioradialis, the knee, and then we will do the Achilles, and then the plantar. And then we'll also assess for the Babinski reflex, which is negative. Last, we will move on to the nervous system. We have already established that Thomas is conscious and alert. He is following commands appropriately. So now we will test his recent memory. Thomas, can you tell me what you had for lunch today?
Hamburgers and hot dogs.
Perfect. Okay. And then we will check the remote memory. Do you remember your last vacation?
Nashville, Tennessee.
Perfect. Okay, so recent and remote memory are intact. And now we will check your orientation. Can you tell me your name?
Thomas.
Can you tell me where you are?
Hofstra Clinic.
And then what year is it?
2020.
And then who is our president?
Donald J. Trump.
Perfect. So he is alert and oriented to person, place, time, and situation. Okay, Thomas, you can sit up for me. What I'm going to do, I'm going to have you close your eyes, and then I'm going to place an object in your hand, and you tell me what it is, okay?
It's a spoon.
Perfect. Okay, you can open your eyes. So he's able to perform stereogenesis. So now what I'm going to do is I'm going to have a sharp and a dull object, okay? So I'll get you to close your eyes again, and I'm going to touch you with either sharp or dull, and you tell me what it is, okay?
Sharp. 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 Soft.
Perfect. Okay, so his sensation is intact and it's equal bilaterally. So now what I want you to do, touch my finger and then touch your nose. Awesome. And then take your heel and run it down your shin. And do it with that one. So that tests our cerebellar motor function, and that is intact. So I'll have a few more things for you if you'll stand up. And then kind of get over here, and I want you to walk heel to toe. Awesome, and you can stop right there. So now what we're going to do what's called the Romberg test. I want you to put your feet together, close your eyes, and just keep your balance, okay? Perfect. So you can open your eyes. So the Romberg test is negative. There was no swaying when his feet were together and his eyes were closed. And that ends our assessment. Thank you so much for watching.